All right, everyone. So I'm going to give you a sneak peek on what's coming. We're going to have a hugely discounted service here on some medical stuff, and the world needs it. And I'll show you why in a minute. But Premier Virtual Urgent Care, basically, fevers, UTIs, pink eyes, migraines, anything. No lines, no paperwork. Get on with the doctor. Virtual Primary Care. You can get on with the doctor there. Mental and health coaching. You can even run your blood work and have them look it over, everything like that. Like this here for mental, people that are, having some issues there with their head, they think. Prescription discounts where you can get up to 1,000 prescriptions, medications for free, and everything else highly discounted. And even discounts and stuff on insurance powered by Aetna, which is really big. And here's the thing, did you know? I like this. 70% of doctors' visits can be handled without ever stepping in an office. 100 million Americans have no primary care. 84 million are uninsured or underinsured. Over 100 million live with chronic disease or obesity. Health insurance premiums outpace wages 300%. The average family plan now costs over $24,000 a year. Despite spending 4.5 annual U.S. ranks last in chronic disease, Latino, Black, and Rural face the worst outcomes. I like what it said. This isn't corporate care, it's human care. Okay, so we're going to I'm not going to show you the plans here because our plans are different and discounted. But what I wanted to do is get you off to the running. And where's it at here? I thought I had a graphic already saved. Hold on a second here. So I designed this graphic. I'm going to put it down below that you guys can start grabbing it to get leads. You can just say, hey, who do you know needs discounted health care? It's not medical insurance, so we can't say it's insurance, but it is basic health care. And it does a lot of things that insurance does, right? That people actually need. So I'm going to give you this graphic so you can get off to the races. It's coming very, very soon. We're this close to launching into the back office. And a whole family could be on it, I think, for like $49 a month, which is crazy. Again, we're giving you a huge discount. Just to tell you how crazy that is, I had actually got shingles about 2 months ago, which were very painful. And I was sitting here and I'm like, oh my gosh, what am I going to do? And I didn't feel like just going to the doctor. I was too busy, this and that. So I tried to do some telehealth stuff. And I paid $45 for one single call. And then they prescribed me, and it wasn't even a free script. I had to pay for my script of some like cream or whatever stuff. It was just miserable. I had to try to take pictures and all this kind of stuff and send it in. And it was actually a horrible experience. The first time I went to get health care or call a doctor, they never even called me back. I bought it and I'm like waiting. I think that was like $30-40 and I'm waiting all day and nobody got a hold of me. So I complained to them, refunded it, and then went with another service, which was kind of a pain in the butt too. So this is nice because it's not going to be a pain in the rear end. It's going to be very easy. And you're going to cover a whole family for what I paid for one single telehealth visit, okay? And you get unlimited stuff. So really, again, we're giving people stuff at wholesale. Do they need to buy it? No. Do you need to buy it? No. But the fact is, if you need something like this, dental, vision, vision's, with me, vision's important. Like I got to go in and got to get my eyes checked, because if I don't get my eyes checked, they won't give me my script. So you got to have this done. And then I get like big discounts off of frames and glasses and contacts and all this kind of stuff. So this is a really cool program. I'm doing it for sure. Even if you're insured, a lot of times insurance doesn't cover everything. And this is nice to have extra, even if you have insurance, because insurance sometimes have big deductibles too. And sometimes you're going to have to pay for medications that you might be able to get through here for free. So big things coming, huge industry. Years ago, I was in an MLM that just offered telehealth, and I made a fortune on it because everybody needed it, and it was like $120 a month or something. So we were selling it for like $120 a month. I was like the top recruiter in that company, made a lot of money because I've always believed in it. I've always been self-employed, and insurance for me is very expensive. I was doing health share for a while, and then they ended up screwing it up. They didn't pay the bills, and I had to chase that down. It was a nightmare with health share. I thought that was going to be good. And then if you go to buy insurance like myself, deductibles are huge. Because we don't have it when you're self-employed. Sometimes you don't have where your job will kick in and pay for stuff, and it's just crack city. So if you know anybody that is like self-employed or a hustler or whatever, this is a perfect thing. And again, even with the $20 a month for the SaveClub membership in this, they're still saving a ton for an entire family. And then they get all the other stuff, going to eat for free, get discounts on appliances, and all the other fun stuff that we do. And heck, if you go and you put your discount, your bills in, all of you should have already uploaded all your bills so far. You'd probably be saving enough just with the cuts in the bills to pay for this. So if you're worried about, do I have to pay for this? Make sure you've uploaded your cable bill, your cell phone bill, your internet bill, and all that stuff, and let them go negotiate the price, and probably you would save enough where you could just add this and you're not even going to feel it because You save the money on the bills already, okay? So that's another benefit with SaveClub is get your people doing that, and where they're cutting their own bills and have enough money for stuff like this. So I'm pretty excited about this product rollout. This is one of many things that we're doing out there. Obviously, health is a big thing out there, and we're going to have that too. We're going to have it covered. Super excited. Wanted you to be the first to know. It's rolling out very, very shortly. And go use the graphic. It's down below, and get busy getting leads. Get busy getting people asking you questions about this, and then or just get them signed up and tell them I'll be here like in a week or less. Okay, and then they'll be able to get it. All right, talk to you later.